talking about the diseases and proper care of the circulatory system. There is a wide range of diseases that can affect the circulatory system. This includes dysfunctional conditions of the heart, blood, and blood vessels. Here are some circulatory diseases and how we can prevent, detect, and treat them. So we have this what we call cardiovascular diseases. Cardio means heart, while vascular refers to the blood vessels. So cardiovascular diseases are disorders involving the heart and the blood vessels that carry blood to all body parts. Ischemic heart disease refers to inadequate oxygen supply to the heart muscles due to impaired blood flow to the heart. This condition can be generally traced to excessive fat deposits known as arteriosclerosis and excessive buildup of plaque referred as atherosclerosis that results in the narrowing of the heart or coronary veins causing obstruction of blood flow to the heart. Angina occurs as a pressing discomfort of squeezing pain in the chest when some part of the heart fails to receive enough blood. Such condition is due to obstruction of blood flow because of narrowed or blocked atherosclerotic coronary veins, and this can be felt in the shoulders, arms, neck, or jaws, and it may be caused by physical exertion, heavy meals, alcohol consumption, cigarette smoking, emotional stress, and even extra heat or cold. Heart attack occurs when the supply of blood to a part of the heart is completely cut off, when a blood clot blocks an artery going to the brain, or in worst cases, when such artery bursts, a stroke occurs. Severe cases of heart attack and stroke can cause sudden death. Cardiac arrhythmia is characterized by abnormally high or abnormally low heart rate. Extreme fluctuations of heart rate can result in increased palpitations of the heart with associated dizziness. In severe abnormal cases, the critical condition could be impaired blood flow and may initiate a heart attack. Hypertension or high blood pressure often results from arteriosclerosis. This is because of the extra energy or build-up pressure to make blood circulate in narrow blood vessels. Studies indicate that the higher the blood pressure, the greater is the risk of coronary diseases. Some traditional approach in the treatment of cardiovascular diseases includes medication and surgeries such as angiograms, heart bypass surgery, and angioplasty. Current trends in the prevention of several cardiovascular diseases focus on detection and management of one's hypertension and high cholesterol level. Many studies confirm the positive effects of diet and food supplements have in healing damages to our hearts and in blood. Some examples of blood diseases: paleness, weakness, fatigue, and weight loss among the signs and symptoms that may be observed in the two well-known diseases of the blood, anemia and leukemia. Anemia occurs when the blood does not have enough red blood cells or is deficient in hemoglobin. So these are the oxygen-carrying pigment in red blood cells. The most common type of anemia is the inability to form hemoglobin due to deficiency in iron, vitamin B12, and folic acid. For prevention of this disease, one's healthy diet must include foods rich in these vitamins and minerals. Leukemia is referred to as cancer of the blood. It is a condition characterized by excessive production of white blood cells. It starts in the bone marrow, then spreads out to other body parts. Some symptoms of leukemia are the following: easily bruising or bleeding, swollen gums, and enlargement of lymph nodes, liver, or spleen. Medical treatment of leukemia varies on the type and stage of the disease. Medical treatments may include chemotherapy, radiation therapy, bone marrow transplant, and surgery. How can we show proper care for our circulatory system? To enjoy a healthy life, we need to take proper care of our circulatory system. Here are some ways of taking proper care of our circulatory system. First, eating a healthy diet. This means eating a well-balanced diet consists of the right kinds of food in the right amount depending on our age, size, and activities. Eating the right amounts of food is vital in keeping the circulatory system. Overeating makes us fat and overweight. Next, doing regular exercise. When we exercise, our heart beats faster to allow more blood supply into our muscles. This means additional nourishment and oxygen supply that provide more energy to our body cells. Avoiding risk factors. There are factors that may cause circulatory problems. Some of the factors are uncontrollable, such as age and family history. However, controllable risk factors can be managed and reduced to prevent diseases of the circulatory system. Maintaining a healthy weight. Obesity or excessive weight leads to increased chances of circulatory problems like hypertension, high cholesterol level, and diabetes. Getting regular health screenings. Close monitoring of our blood pressure and periodic laboratory tests of our blood cholesterol level and blood sugar, among others, will help in the proper care of the circulatory system.